All right. All right. Dr. Vieira, did you want to record on your end too?
I believe I am.
I didn't see any notice of that. Maybe double check that.
Let's see. Yep, I'm recording.
Okay. Awesome.
Okay.
Yep. It shows you're recording. You're right. Okay. Hello, everyone. Hey. I see. It's like romper room. I see Rochelle. I see Ricardo. I could just go down the list, right? Good to see you guys. How are things in Kentucky?
Hot. Too hot.
Hot? Okay, hot. Yeah. Yeah. It was 111 here last week in California. So, yeah. But as they say, it's a dry heat. So, I guess we were okay. We survived. So, keep eating, enjoy your food. I'm going to talk at you today. Take notes if you'd like. You know, this is an introduction to like a team training that we do on case acceptance. So, getting patients healthier faster, that's our goal, right? Everybody wants patients to get healthy. We want to get them there as quick as possible. And the amazing thing about that is when we do that, the business is healthy too, right? It's a win-win for all of us. So let's start first with the word sell or sales. How many of you got into dentistry because you love selling and you thought, I'm going to use my sales skills in the dental world and watch me rock? Anybody do that? Okay. How many of you don't like sales and dentistry? Raise your hand if that, okay. Yeah, that's good. I'm with you. Okay. All right. How many of you like to be broke? No, I'm just kidding. No, I'm just playing. No, I mean, I think that's the awkward place we are in dentistry, right? It's like we don't want to have to sell something. And yet, if we don't know how to sell, the patient doesn't know what to do. And therefore, the business suffers as well. And it's this really weird place we're in. I think what we'd all agree is we don't like pressure sales. Is that fair? We don't like pressure sales. Okay. So in dentistry, what we do is we disguise it with things like case presentation. See how it's not sales when we call it that? Or review of findings or a consultation. So if we don't like pressure sales, what we would agree to then is would anybody be offended if I called that like car salesman techniques? With like somebody's family member is a car salesman and they're offended by that if I use that? That pressure technique, like, what's it going to take to get you these leather seats today? You guys know what I'm referring to when I say that?
Yeah.
Okay. All right. So that's where I'm at when I feel that way. Now, we all agree that every profession on this planet has sales to it. Even the preacher's selling a concept, right? Heaven or hell. Even the pharmacist is selling a prescription at the end of the day. Even the artist is selling the piece of artwork at the end of the day. Okay, is that all fair? The problem we have in dentistry is the same dentist I pay money to do an exam. I pay you $180 for you to tell me my problems, then turns around and says, hey, if you give me more money, I'll fix those problems I say I found. Do you hear that conflict of interest we have? That's what's great about a specialist and referring. It's like getting that second opinion. AI's coming out now with this second opinion in your office. So some background on me. I've been teaching this sort of, verbal skills and practice management and systems since 2001. I got my start way back in 1998 with my father-in-law, had some amazing mentors in my life, and now am partnered with All-Star Dental Academy, Alex and Heather Nottingham in Florida. And all we do is focus on personal growth, professional and personal growth. So in other words, if you want to grow your business, you got to grow the individuals that are running it. You cannot grow an entity without growing the pieces of the puzzle, okay? So just to give you some background on myself, I've probably coached over 300 offices all over North America. I speak all over the country on this sort of topic. So it's a joy of mine today to be with you guys and the doctors, Dr. Vieira, Dr. Vidal here, and the team. So thank you, Rochelle, for getting everybody in the room and giving guys just some opportunity here, okay? So to create the greatest team ever means that team is growing. They have a growth mindset, and they are focused on getting patients healthier. That's all we're talking about. Now, Rochelle, when was the first time you heard stuff like this way back in the boot camp days? What year?
Oh my gosh. 97?
Okay. So 1997. So Rochelle and I have known each other since 1998 because that was the first time I was involved. And then 2001 started teaching it back then. So now we've got this evolution of all this information over the last 20 plus years. This is my 25th year in dentistry. And what I want to really simplify what we're teaching. So when we don't like the word sales or the word sell, that means it comes across as pushy. Now, in the sales world, that's called a push purchase. When life thrusts something on you, it would be synonymous with the word need. You need a new hot water heater. You need new tires for your car. You need to pay the bills. You need to go grocery shopping. Anybody get excited about any of those things when I mention them?
No.
Yeah.
No.
Okay. So versus a pull purchase, which is want. Now, you guys, as you finish chewing your food, I want you to finish my sentence for me here. I want to go on vacation. I want to go out to, yeah. Usually those are elective things that we want to spend our money on. Okay. I don't think most patients wake up in the morning and they're thinking about it. And they go, you know what? I want to go get a crown today. I think I want to go get a crown. I by no means believe that to be reality. However, what I do hear from the same people like you sitting in the room that say, I don't like push sales. I do hear them say all the time in their office to patients, you need a crown. You need 4 quads of scaling and root planing. You need an implant. And yet we say we don't like push sales. To me, that sounds a lot like pushy sales. Is that fair? So how do we get around that? How do we get towards that want side of things? How do we move in that direction? Well, a couple things. To do that, you have to understand sales. And sometimes we have this avoidance to going there. And as long as we have that veil in between us and that topic, we will always suffer in a world we don't know how to get out of. So to look at ourselves, look at the verbal skills we use, look at the systems we have and say, okay, how can we manage around this? And there's 2 really easy ways that I want to talk to you about today. The first of the 2 rules of sales that we're going to talk about, if you're taking notes on your phone or have a great memory, here's what I want you to remember. People buy for their reasons, not your reasons. If you are just telling people what they need for your reasons, I liken it to the parent who's parenting their child in the because I said so fashion. Anybody have a parent like I had a parent like that? And I'd say, why? Because I said so. Do you remember that? It was usually followed up with, I'll pull this car over and give you something to cry about. I don't know if that was a sequence. You had it too. But so patients want to know why, but more importantly, we want to know the patient's why. People buy for their reasons, not your reasons. So we want to have a conversation with the patient before we ever open their mouth, understand what they're looking for and why they want that. Now I'm going to oversimplify it today because we got an hour. And when we teach this, we teach it, over 2 days of training. So with Dr. Vieira and Dr. Vidal's team, we did this a year and a half ago. We had some space. Rochelle brought me in, and we did this over 2 days. And this was a piece of that we're looking at today. And has anybody heard of Simon Sinek? Anybody heard of that name before? Okay, so Start With Why is probably his most famous book. But he's just borrowing that from people in the past. That's just regurgitated information, right? So start with why. Find out what this patient wants. They'll say, I want to look good and feel good. I want to keep my teeth or whatever it is. Your next question you're going to ask them is, why is having that so important to you? If you can remember to do that, what you will hear are things like this. Peace of mind. I want to have confidence. I don't want to lose my teeth like my grandfather did. I don't want to wear a denture that flops around. All of that. Okay. Now, again, I'm oversimplifying how to get there. There's a whole system to getting there, but it's called an emotional exam where you're discovering the patient's why. And I'm giving you a shortcut there. What do you want for the health and appearance of your smile? And why is that important to you? Once you have somebody who says, I just want to have the peace of mind knowing I'm not going to end up, whatever, like family members have. Okay. That's part 1. Part 2 is Second rule, people don't buy a solution to a problem they don't perceive to have. Do we have any admin team members in here today? No admin? Okay. I'm wondering if anybody could still do this even though they're not admin. Have you ever heard a phone call like this where they were calling to, quote, confirm the doctor appointment the next day? And, we've been trying to text message, can't get a hold of them. So finally, the day before, we decided to make a call to them. Now, I'm wondering if you guys can finish my sentence for you, being that you're not admin. Usually I don't do this with admin, but let's see what you guys know. We call that patient. The patient picks up the phone and goes, "Oh, I'm so glad you called me. I was just getting ready to." Do you know what they say next? Yeah. I'm just getting ready to call you. I was just getting ready to call you.
We have some self-admin here, just to let you know. I think there's some admin here that's flying under the radar.
Okay, good. So I was just getting ready to call you. First of all, nobody's ever excited the dental office called them. Okay, so we're never excited when they say that. We never go, "Oh, I'm so glad you're excited I called you," because we know what's coming next. You know what? That tooth, they say this. They go, "You know what? That tooth, it's not even," what do they say next? So I'm going to go ahead and cancel my appointment. Yeah. Now, how do I know that, and how do I know you guys are going to be able to finish that sentence? Because I know that your life experiences are very similar to my life experience because the human being doesn't really vary too much. People don't buy a solution to a problem they don't perceive to have. So I say no pain, no problem, no pay. They don't understand the diagnosis. Therefore, why spend the money on something you don't understand? It's just out of blind trust for some people. "Oh, well, you said it. I paid you money. You told me I had these problems. Let me give you more money, $1,500 to fix these problems that I don't even feel. I don't even see. I don't even notice. I can't even touch it. I can't even grasp what's going on." I had a client I was just working with in Canada, and they were talking about the associate and then the senior doctor both coming in for separate, just didn't want to muddy the water, let clean second opinion on a vertical fracture. Patient did over, 80-year-old patient didn't want to extract the tooth on a vertically fractured tooth. So they wanted to go get the root canal and the crown lengthening and all the stuff to save the tooth. So having to have the conversation the right way to remove that tooth, right? Bone graft, implant, all that. So people, when they can't grasp it, have a really hard time spending money on it. It's very intangible for them. They just know they're going to sit down and let you go to work and open their mouth and let you just honestly invade their personal space. So what we have to do to overcome rule number 2 is we have to do selling. This selling requires no money. It just requires buy-in. It just requires sharing of information. Selling the condition. So if you're going to be accused of selling something, be guilty of selling the condition, the diagnosis. But you can't stop there. It also has to be the consequences. So in your notes or your mental notes, I want you to remember a rule. It's called the 95-5 rule. It's just a made-up number I made up. It's an exaggerated number. It's not the 5-95 rule. It's a 95-5 rule. And what it states is that when you're diagnosing, when you're doing an exam on your patient, 95% of your communication is built around talking about the conditions that you see and the consequences that are coming without intimidating or scaring the patient. So within that system, we have some other systems like over here psychology and eliminating limiting terms that shoot us in the foot, terms that break down the conversation where the patient doesn't understand it. So a limiting term would be something like this. You have a tiny fracture with a little bit of bleeding. And there's an MODL amalgam with defective margins and a class 5 buckle. And the furcation's level 3. We're going to crown lengthen, do a crown buildup and a crown on that tooth. Now, out of all that, what did your patient pick up on? What word?
Brain.
They didn't understand any of that mumbo jumbo until I said crown. Now all of a sudden their ears chime in and go, I don't understand model and margin. I'd love to have more margin in my life. A furcation sounds fuzzy. Okay. They don't know what any of that mumbo jumbo means, but they did hear the word crown. And when they hear crown, what do they think of?
Money.
Money. And now we shot ourselves in the foot. We did ourselves a disservice because people don't buy a solution to a problem they don't perceive to have. We broke the chain of command when it comes to communication flow. Because then we're going to say all that stuff, think they got it, set them up and say, okay, well, you need a crown, go up front and see Rochelle. She'll get you scheduled. All right, you're all set. Have any questions for me? No? All right, have a good day. Bye. I got to go over to this other room real quick. And we break that flow of communication. And that's what gets us in this rat race of low case acceptance, low number of patients getting healthy, crown a year club, whatever it is. Most offices tell me the number one objection they hear from their patients is what? What's the number one objection you hear from your patients?
Awesome.
Money. And I would say that let me test that theory. Okay. Would everybody agree money's number one objection you hear? I can't afford it right now, or my insurance won't cover it. I can't do it. This, all that. Okay. What kind of car do those people drive, and what kind of vacations are they going on? What kind of house are they living in? When did they remodel it? What kind of clothes are they wearing? How expensive is their bag? Are you with me? Right? So do they have the money?
Yeah.
They're just not buying in because you told them they have something, and this conflict of interest is breaking the chain of command on flow of communication. It has to be sequential in the right order. So what do we do differently? We sell the condition. And we connect that to their reason why. They want a confident smile where they don't end up having floppy dentures like their grandfather did. So when you look in their mouth, okay, you guys tell me, what's the consequence of gum disease? Tooth loss. 10 points, whoever said tooth loss. Okay. Write those down. Okay. Number 2, what's the consequence of decay?
Root canal.
Okay, so root canal is the treatment to treat the consequence, which is what?
Pain.
Okay, pain. Thank you. 10 points. So toothache or tooth loss. Toothache or tooth loss. Those are the consequences that we're conveying to the patient because they don't get it. That tooth's not even bothering me. I'm going to go ahead and wait. Wait for what? Yeah, more expensive treatment down the line, right? And if you do root canals, you're like, sure, sounds good. You do implants, great. You'll lose a tooth. We'll do an implant later. This is awesome. We were hoping you weren't going to buy the crown. That's great. So we're going to get away from telling people you need 4 quads of scaling root planing. You need 4 crowns. Go up front and see Becky. She'll get you scheduled, because that is pressure sales. Instead, it's going to sound like this. Earlier, Ricky Bobby, you shared with me that it was really important for you to have that peace of mind knowing you weren't going to end up like the family members that end up with floppy dentures. As you heard during the exam, I'm really concerned about the infection in your gums because that's what leads to tooth loss. That's probably why Grandpa lost his teeth. You see how I'm connecting those things? Now I'm not telling them what they need to do. I'm saying, you said you wanted this and why you wanted it. Here's a condition that invades with your ability to get that. And I'm going to show you how all that looks on a screenshot here in a minute. But that's where we're going with this. Okay. Does it make sense so far? Okay. So far. Okay.
Yeah.
You just raise your hand if you have questions for me, by the way. I have a tendency to talk really fast, especially when I know I got an hour. Okay. This is only 14 hours of information in 1 hour. So here we go. So when we do this exam, instead of all of those terms that they don't understand, you're gonna mix in your layman talk, which you guys are familiar with. You're gonna get rid of little. You're gonna get rid of, kinda, possibly. These are wavering terms that get in the way. Things like you maybe might want to kind of someday think about possibly considering the slight chance of maybe doing something like this. You want to go home and think about it and let us know. These are the things that get in your way of the patient being convinced that there's a real problem. When you're wavering, they're wavering. Now, you may not recognize you're wavering, so you need your team to identify where your limiting terms are. Dr. Vidal, when we got back after the program, we're going through coaching, what was the limiting term you figured out you were using repeatedly? You were, I didn't even hear it until now I'm aware. What was it?
A little bit of infection.
Little bit of infection. That's a probably number one survey says. Little bit of infection, little bit of bleeding, a pinhole cavity, just a tiny filling. It's no big deal. Go up front and they'll get you scheduled. I'm going to wait. Why would I go spend $250 for something that's no big deal? Why would I spend $250 for something that's no big deal? I'll wait for it to be a big deal. I'm going to wait and then I'll get it done. Why would I spend the money now? I'm not going to go get new tires until I need new tires. Oh, but I like the way they look. They're so shiny. There's no curb marks all over the outside of it. Okay. So you're going to say it like this instead. So, Virginia, my assistant, will be charting. I'm going to call out the information, patient's hearing it, and I say, Virginia, tooth number 2 has a large old metal filling. It's an MODL. It's got a gap between the filling and the tooth. There's defective margins there. I'm concerned about the decay that's underneath that old metal filling, and it's burrowing its way towards the nerve of the tooth. There's also a separate cavity on the cheek side of the tooth as well, a class 5 buckle there. I'm concerned about bone loss around this tooth, and I want to do everything we can to save this tooth. Foundation full coverage. So I said crown buildup and a crown, but the patient didn't hear that. I'd said everything that Virginia needed to chart everything on there. I gave her time to do it, and my patient's also marinating in the co-diagnosis. I'm selling the condition. Did you guys hear it? Some of you probably do something like this, okay? And then I'm going to ask the patient, I'm going to keep them involved, right? Especially a guy, you got 7 seconds to keep their attention. So I'm going to ask a question and keep him engaged, okay? And I'm going to say, so has this tooth started to hurt you yet? It's called an implication question. I'm implying pain is coming. I say, so has this tooth started to hurt you yet? And what are they going to say?
Oh,
Not yet.
No, I'm good. Nothing to see here. Move right along. Nothing to see, doc. Keep moving. No pain here. Okay, so you got to follow it. You say, have you ever had a toothache before? No? Good. Keep on moving. Just keep doing your thing. You go to a hygiene room to do an exam and they say to you, don't find anything today, doc. Right? This is the psychology of what's happening in that chair when you walk in the room, and you got to overcome that. So you're not going to find anything. Well, I hope I don't. Let's see. So you're calling out that condition. So now you're going to third question it. Have you ever heard of a root canal before, Ricky Bobby? Yeah, I've heard of a root canal. Why would you say that? Why would you use that term to me? It never surprises me that a tooth in this condition hasn't started to hurt yet, and that's great news. That means we caught it before it needs a root canal. It means as soon as this tooth hurts, as soon as there's pain involved, sensitivity, as soon as that decay is broken into that nerve chamber, it's like the center of a Tootsie Pop. That tooth, the only way to save that tooth is to remove the center of the Tootsie Pop, the gum, the nerve out of there. Our goal for all of our patients is to help them prevent that from happening. Tooth number 3. Tooth number 4, and you go through that same sort of sequence. Now, you're not going to ask all those implication questions the whole time. You're going to just make sure they're staying involved. Oh, this tooth reminds me a lot of the other one. Did you have those old metal fillings put in about the same time, about 15 years ago? Yeah, about then. I think I had them done at the same time. Yeah, now that you mention it. And then you get your intro camera out and you're showing pictures of what you've described. You're doing the iTero. You're showing the scan of what's all the wear on the lower teeth. Remember I was talking about the M&Ms and the inside, the chocolate on the inside and the hard outer shell being gone? This is what I'm talking about right here.
No.
These are things that you can do. You need to come up with your own vivid description so they understand the condition. Because if they don't, they're going to think it's normal because they don't feel any pain. What's the definition of insanity?
Doing the same thing over and over, expecting different results.
10 points. Who said that? Okay, so if you need counseling, I want you to see the young lady in the back because obviously she's had some counseling. No, I'm just kidding. My wife, my wife's a counselor. She's amazing. I think everybody should be in counseling. But a lot of people hear that definition. They go doing the same thing over and over again, expecting a different result. I keep telling patients they need crowns, and yet they don't schedule. They cancel. They don't do all of it. They do 1 crown a year club. Why am I not getting different results? I keep telling them they need a crown. This is that opportunity. This is opportunity knocking for you to change your practice and get your patients healthier faster. At least I like to think so. So I want you to go back home, go back to your practices and look at the selling of the condition that you're doing it. Look at that 95-5 rule and see how you're doing with that. Are you using a preclinical conversation to find out what they're looking for their mouth before you ever tell them from your position what they need? Do you have a conversation piece that you do to find their why they want what they want? Okay. Now, perio, right? Right, Dr. Vidal, perio. We do the same thing. We do overhear psychology. So the patient hears a diagnosis. We preface it with, I'm going to evaluate the health of your gums. I'm going to use my small ruler and I want to see how healthy your gums are. Think of it like measuring the foundation around a fence post. You want tight cement up against that fence post so that fence post doesn't move at all. You have to be really, really healthy. And we want 0 millimeters, 1 millimeter, maybe 3 millimeters of gap in between that cement and that post. If the gap gets bigger than that and starts washing down, that's a concern. If that were the case, we'd talk about it. Okay. Now, as the bad breath is rising out of their mouth and you're brushing away the fog and you clean your glasses off a bit and you go in, you start calling out numbers, right? And now they're co-diagnosing with you to hear what's going on. 454, 676, 9er, midline checking for bleeding. All right, 3 distal, 4 all points, 5 mesial, 6 direct, whatever it is. Okay, you're going around half the mouth. And then you decide, okay, I got to get this patient involved in this process. Implication question. How long have you had this infection? What infection? Right, I'm implying something. Oh, I've always had pink in the sink. Okay. Right. These are the things that you hear from your patients. So then you say, have you ever seen someone who has really long teeth and black spaces in between their teeth? Yeah. Why? That's someone who's in the next phase of gum disease beyond you. And there's no recovering from that they're on their way for tooth loss. But if we do something now for you, I can help you not get to that place. I can help you not get there. But I can't make it better. I can't regrow cement around the fence post. I can just stop it where it is. Okay. Things like that you involve your patient in the diagnosis, that's what you have to sell. There's a very, very, very fine line between selling the condition and intimidation. I never want to scare the patient. You need to read the patient. You need to know how much they can handle, and you need to know what they're not getting and what they are getting. That's part of your emotional intelligence, your relationship management, your sales skills. Okay. Is this resonating with you guys? Okay. Now, let's say we do everything really well. We find their why. We do a really good job at selling the condition and the consequences, and we're putting those two things together. I want to share the screen and I want to show you what we do next. Okay. Let's see if I can do this well. Technology. You guys see that okay?
Yep.
Beautiful. Look at me. All right. So I wrote this in 2007 with the help of 2 of my clients, mentors, and friends, 2 dentists, Dr. Ted Morgan, Dr. David Peer. And we sat down and said, all right, the human brain is processing information. And how does it process it? Well, first, people buy for their reasons, not your reasons. So we should start with that. Earlier, you told me it was really important for you to have peace of mind, confidence, avoid pain, job promotion, beautiful wedding photos, whatever it is. You're always going to preface your presentation with what's important to the patient. That's why importance highlighted, because that's the key word I'm going to remember. Okay. By the way, if you want this, when you decide to, it's eric@allstardentalacademy.com. You can email me. I'm happy to send this to you. Just say, hey, I want that case presentation form that I hand out, and I'll send it to you. Happy to do that. Now, you say earlier, you stated it was really important for you to have peace of mind. Having considered that throughout the exam, I am concerned. I'm concerned about the infection in your gums, and I'm concerned about the amount of decay. I'm concerned about fractures. I'm concerned about the missing teeth. Okay. Now, keep in mind, this isn't the first time they've heard your concerns because they've been paying attention during the exam. They've been a part of that. The reason I'm so concerned about those things is because that's what leads to toothache and tooth loss, and you describe that process to them. Now, in the 95-5 rule, you're not allowed, just don't get distracted with all this fancy stuff over here. Okay, just focus right here for me, 95-5. In the 95-5 rule, you're not allowed to talk about the 5%, the treatment, until this line is removed. This is a barrier. Do not cross this line. You're only allowed to talk about condition and consequences until they say, yes, I believe I have a problem. Yes, I would like you to fix it. Okay? Make sense so far? Okay. So you do what's called testing the buy-in. Did they buy the condition? Now, I do some basically linguistic communication training. I need a volunteer. All right, let's see. All right, let's see. Sitting right in the front row, black shirt, sitting like this. What's your name?
Oksana.
What's the name?
Oksana.
Oksana. Okay. I'm going to ask you a question and I want you to give me a yes response, okay, if you can. All right. So you're thinking positive and you're on board with me. You want to move forward. So I say, Oksana, would you like to go ahead and get this scheduled?
Yes.
Yes. Okay. So I got a yes answer. Now, have you ever had a patient said, yeah, sounds good. 6,000? Okay. Yeah, sure. Tomorrow? Yeah, I'll be here. You ever had that patient? And what are you thinking right away when they say all those yeses? No way, right? We call those the yesers. They just yes you just to get out of the room. Okay. So what we realize is patients can lie to you in one word. Oksana just lied to me in one word. She said yes. She said yes, but she meant no way. Okay. Now, I'm going to change her ability. Now, you're still going to say a positive response. If you can say yes, say yes. Okay. So I say, Oksana, how concerned are you with the infection in your gums?
I'm very serious, you know.
So do you hear? This is good. This is good. No, this is a perfect answer. Do you hear how she can't say yes, but she wants to say yes? Do you hear it? And now she can't lie to me. So that's why the word how is so important. Take this home to your family. You tired of getting one word responses? Use it with your kids. Use it with your spouses. Okay. Use this with your patients. So when I say how concerned are you with infection of your gums? Yeah, I'm really concerned. But they won't lie to you. If they're instead of saying yes, yeah, they'll say, well, actually, it's not bothering me. Okay, great. Well, let's talk about 4 quads of scaling root planning then. It doesn't make sense, right? You can't go there. So what I'm saying is, when we wrote this, we realized we need something that doesn't allow you to talk about treatment until it's appropriate to do so. Are you with me?
Yes.
Okay. So now when you say, how concerned are you with the infection in your gums? Yeah, I'm really concerned. Okay, well then, would it make sense then for us to talk about a plan on how we can take care of that infection in your gums? Yes. So I got 2 positive responses to move this line out of the way. And now, oh gosh, I can finally talk about scaling root planning. But on a ratio, it's a very small percentage of time spent. Only 5% of my communication time is in this treatment. Okay, so we're going to gently clean beneath the gum line, pre-surgical, okay, so that you can save your teeth. And we're going to touch and reach areas beneath the gum that you cannot reach. Right? You describe the 5% of treatment. I'm not too worried about teaching that today, okay, because you're doing that. I don't tell them you need something. Need is a 4-letter word. I don't use that word, okay? And then again, back to the how word. Okay, let's go back to Oksana. So again, a positive response. Ready? All right, let's do it the wrong way first. How soon? Let's do it this way. That's a how. I don't want to do that. Would you like to go ahead and get this scheduled, Oksana?
Yes, I am.
Okay, yes. She says yes, but she might mean no, right? So now, same positive response, positive thinking. All right, how do you feel about moving forward with this plan?
I mean, usually what we say, we just kind of divide it. 4 quadrants, we do like a half mouth and a half mouth, you know.
Sure. Again, I'm not worried about how you treatment plan it. I want you thinking like a patient, how a patient respond positive. Like I want you to hear that someone can't simply just say yes to that question. Even though they want to say yes, they have to give you either a real reason why no or a real reason why yes. Okay. So I want you to think about how you'd respond to this question in your mind. How do you feel about moving forward with this plan? Yeah, sounds good. That's how I would respond to it. Yeah, let's do it. I always have to give more. That's what you want to hear. Now, you might whittle that down into, great. Well, we would do half of your mouth at the first visit. We'll spend 2 hours getting you healthy, and then we'll do another visit here. And so it'll be 2 separate visits. We'd like to keep those within 2 weeks. How soon would you like to go ahead and get that scheduled? There's that word again. Instead of, would you like to get that scheduled soon? Do you hear the difference? I give myself a greater opportunity to get patients healthier faster when I use the right sort of verbiage. Does that make sense? Okay. So I never say to a patient in replace of this question, let me show you again. I never get down here and say, would you like to go ahead and get this scheduled? I never say, do you see any good reason why you wouldn't want to go ahead and get those leather seats today? Back to the car salesman, right? I never say, do you have any questions for me? All right, go up front. See Kelly, she'll get you scheduled. Because that's not asking. In dentistry, the studies show 64% of us never ask the patient if they want to schedule. We say things like, all right, you're all set, go up front, they'll get you scheduled. Same thing goes on the phone with new patient phone calls. Almost 2/3 of the time, we never get to a place where we ask the person to schedule. So we have a way now to get out of that. This is something I've used for a long time that works really well with a lot of clients. And it changes the statistics on patients getting healthier. Why does it do that? It does that because now they understand 2 things. One is there's no pressure from us. I'm buying for my reasons, not your reasons. I'm buying for confidence. I'm buying for my own reasoning, not because you're telling me what I need to do. And number 2, I fully understand where I am on the health spectrum and where I'm going if I don't do anything. What are the consequences of not doing anything? That resonating? That making sense? Okay. Now, do people say yes and then cancel or have an objection later or can't afford it still? Absolutely. They're still going to need some opportunity, some ways to handle it. So if you say, how do you feel about moving forward with this? Yeah, sounds good. Okay. So we would go this way and this way. How soon would you like to get that scheduled? Well, how much is it going to cost? Do you see how that would be a question they would ask? Okay. You're clinical. You would then say to them, we've got magicians out at the front. They're I don't even know how they do it. They're magicians at figuring out not only the cost, the insurance and everything, but how to fit this into a budget and make it completely affordable for practically all of our patients. If we can do that part, do you feel like this is the right plan for you? You see how I still got to a question mark? Yeah, as long as I can figure out how to make it affordable, great, they are in. And then when I walk out and I see, the Kellys and Rochelles and everyone, the Catherines and everyone, Connie's up front, I go up front and I say, Connie, Dr. Vieira and Ricky Bobby were talking, and they're both concerned about the infection going on in the gums. It's really important for Ricky Bobby to have peace of mind knowing that we're going to take care of this before it becomes a bigger problem to him. He doesn't want to go down that same path. And so he wants to go ahead and get this scheduled. Right, Ricky Bobby? And you look at Ricky Bobby and you shake your head. And what does Ricky Bobby always say? Shake and bake. That's a yes. That's a yes. We got a yes, Connie. Okay, so I'm now empowering the next person in line that wasn't back in the clinical area to hear this. So I hit those 3 points. I hit everything that was on there. Their commitment, because they said yes. They want to do it, not need. I said it was important for their reasons, not my reasons. And I shared the condition, what we were concerned about. Now, someone in the room, I have a hypochondriac somewhere in the room, and their alarm started going off. Oh, you can't say that at the front desk, Eric. You can't do that. Okay, that's totally fine. I'm with you. Then you also can't say they need scaling root planing, they need a crown, or any of that, because that's the same infraction. Okay, so you got to figure out a soft, quiet way within reason to share that with the next person. Okay, does that make sense? So let me give you the systems we went through today. Eliminate limiting terms, selling conditions, discovering their why, overhear psychology, implication questions, case presentation formula, and transfer of care. Those are 7 systems that I spent an hour teaching that we covered in 45 minutes. Okay. Not meant to overwhelm you, meant to shed some light on opportunity for you. You might leave and get 20% of tonight. Great. We're going to have increase in results. I know at some point in some office, patients are getting healthier. I've done my job. Okay. So I've left a lot of room, a lot of time here, a lot of space for us to talk about this. Challenge that system. Challenge that system with me. What potential roadblocks do you see? What concerns do you see with that? What questions or clarity do you need from this? This is a study club and not just a sermon. So what did you hear that I didn't make clear or that you're questioning or concerned about? Okay. Yes, Dr. Vidal.
Eric, could you repeat quickly how we transition from the conditions to now that five,
Yep.
like.
Yep.
there's
Yep.
the key there?
Right here. Yeah, these two questions right here you're talking about.
Yes, please.
So I've connected the patient's why, what's important to them, to the diagnosis, the conditions, and the consequences that are coming. And now I need to know if it's going to be okay for me to talk about treatment with them. Did they buy in? So I used, how concerned are you with the infection? How concerned are you with this missing tooth? How concerned are you with this missing tooth causing the other teeth to collapse in and cause you to lose those teeth? Now, if they're not concerned, I either did a really bad job or they have very, very low care and really don't care about their teeth. However, they would not have shared something important to me earlier if that were the case. Oh, my wife sent me in. I'm just here to make my wife happy. Okay, so it's really important for your wife to be happy. I'm concerned about the infection in your gums because it causes you to lose teeth, causes bad breath. And I know it's important for your wife to be happy. Do you think she would be concerned about you losing your teeth? Yeah. Okay. How concerned are you with her being concerned about you losing your teeth? Okay. Would it make sense for us to talk to you and your wife about how we can help you save your teeth? So there's 2 questions right here, Dr. Vidal. How concerned are you with the condition, right? How concerned are you with taking care of that? That is fill in the blank. They're concerned about it. They're very concerned about it. They give you some sort of positive response. Okay. Then wouldn't it make sense for us to talk about a plan and how we can help you take care of that? Yes. Okay, great. Here's the 5% treatment plan now. And at the end of the treatment plan, I say, how do you feel about moving forward with this plan? Now, again, I'm not going to talk about treatment if they say they're not concerned. Make sense?
Yes.
Okay, good question. Listen, guys, you ever remember in high school when you went to math class and you were in pre-algebra, calculus, whatever it was, and the math teacher's taught it a million times. He's going really fast. He's skipping bring the negative number over and the other equal sign. He's just skipping steps. You're like, how did he get there? Sometimes I'm like that because I've taught this so much and I want to give this to you and I want you to have this information to go use it. And so I know I go fast. We're going to have this recording. You can watch this with your team. We're going to put it up on YouTube so you can replay it. And I want to create as much value for you as possible. Okay. Okay. If you like what you heard today, of course. If you didn't like what you heard, then that's okay. That's okay. What's that definition of insanity again? Okay. Yeah. Same thing over and over again. So I'm the movie ticket salesman. Okay. Now, how the story goes, if I'm the movie ticket salesman, his little boy goes and watches the movie and the yellow lab dies at the end of the movie and he cries and the little boy goes back out to the ticket salesman and buys a movie to see the same, buys a ticket to see the same movie, goes back in, cries again, comes back out and is crying and looks at the ticket salesman and says, I'm going to watch it again. And he goes and watches it again and cries again at the end, comes back out for the 4th time. Finally, the ticket salesman says, why do you keep going to see the same movie? And the boy says, what? I want the movie to end a different way. Well, you're going to drive yourself insane if you keep thinking going to see the same movie is the right way. Let me sell you a ticket to a different movie. Here's a different movie, has a happy ending. Let's go watch this one. So if you have the same system going on over and over and over again, and you're getting this much case acceptance and you want this much case acceptance, something has to change in the movie. Something has to change in that system. Is that fair? When my father-in-law first implemented this system, that's how I got my start in dentistry. I had some job security as long as I took care of my wife. We doubled our practice. So in 1998 to 2000, we went from 552 in 2 years to $1 million. That's a pretty big jump back then. 4-op practice, very small, all with this system. Version of this I've adapted over the years. Back then we were saying things like, do you see any good reason why you wouldn't want to save this tooth? We've just evolved. We've just gotten better at it. Okay. So I promise you this works. Some of you are using some of this already, and we're just adding some nice, stacking some habits to it. Okay. So I want to encourage you and say, use it, start trying it, see what sort of results you get from it. Don't try to memorize it, try to internalize it. Try to really get what we're trying to accomplish here, okay? And then, of course, All Star Dental Academy is here for you if you want more support. Just allstardentalacademy.com. We have amazing, amazing coaches. We have easy systems and training to use. We have coaches all over the country. And I just happen to have a long-term relationship with this practice. So known them for a really, really, really long time. No Charlie Barrett today?
No, but Charlie Barrett Jr. Did inquire, and we're gonna get him. He wanted to get a copy of this. So
Okay.
he's gonna get-
All right. I'll accept that. Yes, question. I saw a raised hand.
Yeah, could you just give another example of that initial question, like with a new patient with the how important,
Yeah.
like how you start that?
Yeah, for sure. So again, this is an hour teaching in less than 5 minutes. Are you ready? It goes like this. You introduce the conversation because they need to know what's coming before they'll ever engage in it. If you just start asking questions, they're going to look like you got 6 heads. Like, why are you asking me this? So you introduce it. What's your name, by the way?
Carrie.
Carrie?
Huh? Yes,
Kerry?
Keri.
Kerri. My mom's name is Carrie. That's what I was asking. Okay. So Carrie, so before we ever look in your mouth, we need to know what's important to you first. So I want to ask you a few questions. And the more information you give me, the more likely we are to be on the same page and for us to give you exactly what you're looking for from us. Everybody's different. Does that make sense?
Yep.
Okay. And I want to hand you a mirror. And I want you thinking about 2 things, Carrie. I want you thinking about how it looks, but I want you to think about how it functions and feels. All right. Now I want you to share with me all the things you're already happy with, the things that you love about your smile and how it functions. What are those things? Describe them for me, Carrie.
I like the shade of my teeth. I like the shape of my teeth.
Perfect. All right, let's flip the coin. Describe for me all the things you feel like are challenges, things you don't like, things you wish you could change about it. Paint me a picture. What are those?
I grind my teeth. I get food stuck in my teeth.
Okay, great. Okay, so ideally, what do you want to do about that? What does it look like? How does it function ideally for you?
I don't get food stuck in my teeth, and I stop grinding my teeth.
Beautiful. Makes sense. Why is it important for you to make sure you stop grinding your teeth and you stop getting food stuck in your teeth?
I don't like flossing all the time, and it wears my teeth down. I don't like
Yeah,
that.
there's some consequence to that going on, right? So there's some maybe peace of mind or some fear of what could happen. Does that make sense?
Yes.
Okay, now I'm tapping emotion into it. People buy with emotion, justify with logic. People buy for their reasons, not your reasons. Your reasons are typically emotional, right? So I took you through a process, an introduction. I went with the positive first. I went with the negative second. And then I said, you tell me what you want. Okay, why is it important for you to have that? Peace of mind, knowing I'm not going to lose my teeth, becomes the emotion attached to that. Now, Carrie, you don't have this, but let's say we fast forward in the exam and you got gum disease, you got fractured teeth, you got decay, you got these things. I'm just going to connect all those things to that peace of mind now, and you just interlock all of that. That's your preclinical emotional examination. It's a conversation that you have. Does that make sense?
Yes, thank
Okay.
you.
Even for a patient that's healthy, let's say you had the ideal smile. So really what you're telling me, Carrie, is your mouth is perfect right now. It's ideal. It's how you want it. It's about keeping it that way. Am I right? Okay. Why is it important for you to keep your teeth this way? Oh, my grandpa lost his teeth, or I don't want the expense of going through that, or whatever emotion is attached to that. So now if you diagnose something, you have something to tap it into. You see how that works, guys?
Mhm.
These 2 systems are interlocked. People buy for their reasons, not your reasons. People don't buy a solution to a problem they don't perceive to have. I cannot stress that enough. It's the psychology of sales simplified in an hour. Okay. Now we're not selling. We're getting what's called mutual agreement. These people will now feel like they got good advice from somebody they trust. You paid me money to tell you your problems. And if you would like, it's up to you. Do you want to move forward with this? Okay, great. We take care credit too. Yes. Okay. Any other questions about this? Okay. So, you ever heard the saying, knowledge is power? Okay. And it's a partial truth, right? Otherwise, there wouldn't be any physicians who smoke. Okay. Knowledge is power when you put into action. So I've shared some knowledge with you. Some of it you liked, maybe all of it you liked. Okay. I shared some knowledge with you, but it is weak. It is pointless. It is powerless without implementation. So my plea to you, my challenge to you is stumble through failure on your way to success with it. Trip and fall over your words. Don't pull back out of fear and doing it the same way over and over again. Push through that fear of uncomfortableness. I've never said it this way before, and that's okay, because you're never going to get the results you've never gotten doing the same thing over and over again, right? What got you here will not get you there. More patients getting healthy means say something a bit different. Slowly start to increase and implement that. All right. Now, no matter what I ask you next, I need everybody to say yes, just to make me feel better. Okay. You ready? Everybody's going to say yes out loud. Will you do it?
Yes.
All right. That makes me feel good. All right. All right. So it's Eric at allstardentalacademy.com. You're going to have some questions that you might feel more comfortable answering private. I told Dr. Vidal, I just want to add value to him because you refer to him and Dr. Vidal. Okay. These two guys are important to me, which means you're important to me. So I want to take care of you guys because they mean so much to me. So that law of, what is that? Law of compensation, or you know, somebody gives you a gift, you want to give them a gift back. You know, at Christmas, you're like scrambling to find a gift card somewhere because you didn't know it was a gift exchange. Okay. So I want to share this gift with you so that you'll continue to share your gift with these doctors and continue to develop your relationship with them on your cases. Is that okay? So having said that, you just email me and you need to schedule a meeting with me. I'm happy to do that for free for them because they mean that much to me. Okay. So if you see value in this and you want more, I'm here to help you with that. Okay. Sound
Thank
good?
you.
Absolutely. Yeah. You just email me, Eric at allstardentalacademy.com. We'll have this recording up. You guys can watch it over and over and over again. Dr. Vieira will get you the link to that. Okay. Does that sound good, Dr. Vieira?
Yes, we'll send that to everybody who's here. We got your sign in.
Okay.
Yes.
I was, just so you know, Dr. Vieira, I was going to say, if you need anything, I'm here for you. Just email me at mvieira@gmail.com and I'll. All right. All right. One last laugh. Thank you guys so much for your time. I appreciate it. I'll see you in a couple months. We'll do insurance freedom next time. We'll talk about how to not be so reliant on insurance with your patients and have it be a pain-free conversation that allows you to be out of that restriction of insurance and what they're saying is covered, not covered, and maximums and all that good stuff. Okay.
Thank you.
Thank you.
All right, guys. Hey, Dr. Vidal. All right. We'll see you guys. Bye.
Thanks, Eric.